It took 7 years of battling to try and get the diet, 7 years of the drugs not working, 7 years of Matthew having hundreds of seizures a week before we finally got the diet. And when we get the diet, he has a 90% drop in seizures, and all of a sudden he has his quality of life back. I got what was left of my son back, and he got what was left of his life back. And that's why I set up Matthew's Friends. Through support, information, training and research, we have helped change thousands of lives, and we continue to do so.
Good job, good Charlie.
Family and patient support are at the heart of everything that we do. We've produced professional films and tutorial training films featuring professionals from all over the world. We've also got our Keto Kitchen YouTube channel. All this we supply freely to try and reach as many people as possible.
As you can see, it more or less forms a donut.
We also have dedicated Facebook forums for families. We've got website professional forums. We've got a telephone support line that's open 365 days a year. So there's always somebody there to support the family when they need it.
It is extremely hard in the beginning, and you will have bad days where you break down and you feel like you can't do it. But when you see what you're doing is paying off, it's like £1 million being put in your hand. Emma has never once not been at the end of a phone to give me advice, to just to say to me, you're doing a good job. I can't explain the difference in Paris. Without the diet, I don't think Paris would be here now.
I know what it's like to need professional and emotional support when you're doing this kind of thing. And sadly, for a lot of families, the ketogenic diet is the last resort. So we need to provide as much help as possible.
What Matthew's Friends as a charity have been able to do is provide additional information that's widely available to families and patients, provides a degree of education, not least for dietitians as well as doctors. So working with a charity like this hand in hand means we're able to complement one another as opposed to working in competition.
Providing information and support is crucial, and that's why we have a medical board attached to us, because we can make sure all the information that we provide to the families is medically sound and correct.
Have a drop of blood on there.
Our information packs and starter packs are freely available to all UK and Ireland centres and their patients. And we will fund NHS centres and dietitians. However much we do, we wanted to do more. So in 2011, we set up the Matthew's Friends Clinic in order to serve adults and children that didn't have a local service available to them. And since then, hundreds of patients have been through our clinic. Matthew's Friends are the only dedicated ketogenic diet charity in the UK, and we've now got groups in New Zealand and Canada. We don't do anything else. Medical ketogenic dietary therapies is all we do. Education is something we're extremely passionate about. So in 2016, we launched our annual Keto College training program. And so far, we've trained over 500 professionals from 36 different countries. But what inspires us the most is that behind those 500 professionals are thousands of families that are now going to get treated by professionals that are confident and knowledgeable about the diet, and they will go on and share that knowledge in their countries as well. In 2019, we wanted to reach an even wider audience, So we launched our Keto College online tutorials. And these were specifically aimed at more resource-strapped areas of the world. So medical professionals there can gain access to reliable training and information to benefit their patients.
A lot of neurologists get a very basic training on the ketogenic diet during their neurology or even epilepsy fellowships. And so meetings like this and sort of extra trainings are critical to really make a center competent in how to do the diet.
Matthew's Friends has some fantastic relationships with some of the world's leading ketogenic dietary therapy experts. And we are dedicated to continuing the funding and support of clinical research into this area. We were really proud to put money into the Great Ormond Street trial. That proved once and for all that the ketogenic diet worked. And the results of this clinical research went global. This is what changed things for the ketogenic diet around the world. And this is why research is so important. And more recently, we have put funding into ketogenic diet and brain tumours. And there are many other chronic conditions that need looking at, and we need to focus on the research for these areas as well. Matthew's Friends has hosted, collaborated, sponsored, organised European meetings, global meetings. We bring together world leaders in ketogenic dietary therapies. By doing this, it will improve treatments for patients around the world. We ensured that the medical community and the families can come together at things like meetings, cookery demonstrations or cookery days. It's important that the professionals learn from the families as well as the families learning from the professionals. So collaboration is key.
Matthew's Friends have revolutionised the availability of the diet, and I think that's what sets them apart from some other patient support organisations. Emma and her colleagues are also mindful of it being a medical treatment and have managed to bring those two things together and support both in a very collaborative way.
It's incredible to think that since 2004 we've invested over 2.5 million into ketogenic dietary therapies, and there is so much more that we need to do. Every week we are contacted by families that have got babies and children that are suffering with seizures, maybe have metabolic disorders, brain tumours, that are looking at the ketogenic diet as a possible help to their family. And I've lost count of the adults that could possibly benefit that we just haven't got enough centres for at the moment. So there's still a lot more work to be done. The more money we get, the more that we can do. Every penny gets invested into information, training, research and support, which will go to help more families and save more lives.